One of the themes I heard was this labor crisis seems to be pervasive across the entire country. It's not regional or market based. And the word that I heard over and over again was headwinds. So I heard that as headwinds, which obviously increases the cost of labor. There's a concern about inflationary pressures coming, additional headwinds. Were there other headwinds that you heard about? And how would you comment on the first two?
Well, I think nearly every presentation dealt with the labor, either in their presentation or through follow-up questions. So it's an issue for everyone. And there were different numbers thrown out. Advent had 440 million in excess agency spend. So if you think about that in a traditional year, that would be right off of the bottom line. Intermountain had $95 million in budget overages. But what you heard in terms of the presentations, Bill, and I think one of the problems is, yes, right now everyone's dealing with, it's a supply issue. It's a supply of labor. And so there were many creative discussions around how they're dealing with the supply issues for labor, whether it's working with community colleges or training programs or team-based nursing. But what I didn't hear a lot of, I heard some of it. I think Intermountain talked about this. Who's dealing with the demand for nursing? How are you changing your care delivery to deal with this nursing shortage? And I think Intermountain spoke about actually kind of using digital and remote monitoring to keep people at home, to keep them well, to avoid the hospital, basically. So they're dealing with not the supply issue, which you have to deal with tactically, but I think it was good to hear, at least from a few of them, not enough of them, is what are you doing strategically to change care delivery to reduce the demand? And that's very hard to do right now when you're dealing with a crisis and your hospitals are full. So it's really hard to be strategic and think about these things when you're in the midst of a tactical crisis. So, but we heard mostly about the supply issues, Bill, and the reaction and the creative responses to the supply. But I think longer term, this becomes a demand discussion. How do you reduce the demand for nursing or deliver care differently? One system even talked about an immigration program, which was bringing nursing labor in from other countries. And ultimately, this is a whole other show you could do, maybe not your swim lane, but in terms of our country's immigration policy, we've always relied on immigration and immigrant labor to deal with the great growth in our country. And I go back to the steel industry and the coal industry in the 20s and the 30s and the 40s. Nobody wanted to do those jobs. And so they relied on immigrant labor to do that work. And you created a whole new generation of Americans basically from that. And we have that same opportunity now in healthcare and hospitality, where we could be training and integrating a whole new influx of amazing American citizens. But politically, it's probably unlikely to happen. But a couple of systems are exploring this option with using foreign labor.